Are all of you connected? And can you hear me?
Yes.
Good. My name is Anders Billström, and I'm representing World Transplant Games. I'm sharing this research initiative. And today I'm very happy that we have two researchers, Professor Bart Rienties and Dr. Leigh Martin, who will cling and triathlete recipients and how can I become more physically active. So I will not introduce Bart and Leigh. They would like to do that themselves, and they will give first of all they will give a presentation, and then we will open up for a discussion. So feel free to wait with your questions. You can raise your hand, and I will just take the questions in some kind of order, and after that you can also write in the chat, by the way. So I would try to keep track of all the questions and so on. So Bart and Leigh, thank you very much for joining us. We are very happy that you could have this presentation. So the floor is yours.
Yeah, thank you so much, Anders, and also thank you very much, Gary and Kim, for inviting us here. So we'll do an introduction in a minute, and we're very comfortable. If you have any questions, you can just post them in the chat, and we will try to get them and talk through them. And it's going to be an interactive session, hopefully. So the reason why we are here is well, we may be interested to improve our physical activity levels. And there is this fantastic quote from the UK Chief Medical Officers that stated, if physical activity were a drug, we would refer to it as a miracle cure. Due to the great many illnesses it can prevent and help treat. And what you see here is a range of pictures from people with a transplant at the British Transplant Games. And of course, there's great diversity in terms of what you can do in terms of physical activity. And while it might be a miracle cure, there's also some recent research that casts some doubts about the benefits of physical activity. So in a recent research by Stelmans, they argue that while exercise can serve as a potential therapeutic intervention after transplantation and is probably underutilized in the transplant population, the line between medicinal benefits and potential harm lies in the dose administered. And here again, you see a range of pictures from the British Transplant Games. And yeah, we will talk a little bit about the potential benefits, but also about the potential barriers to become more physically active. So my name is Professor Bart Rienties. I'm mainly a professor in what you call data or big data. And you see some of my accolades, but actually I wouldn't be here without my mom. So I got transplanted in 2008 on the 6th of August. And I'm extremely grateful that I received a kidney from her, and I wouldn't have achieved all the amazing things without her. And in 2015, I first joined the British Transplant Games, and a completely new world opened to me. And I started to participate in European and World Transplant Games, and I'm a very keen cyclist. So last week, I celebrated 16 years of kidney transplant anniversary with my amazing wife. The week before, we had the European Transplant Games, which was fantastic. And I also learned how to swim because I competed at the World Transplant Federation Games in triathlon. So I'm extremely grateful for the gift of life. And with us today is Dr. Leigh Martin. So Leigh, who are you?
Hi, Bart. Yeah, so as Bart said, I'm Leigh Martin. I'm a research associate here at the Open University working on the transplant research. Like Bart, I'm passionate about sport and physical activity. It's something that's always been in my life. I'm not a transplant recipient. My expertise lies in the psychology of sport and exercise and looking at the behaviour change elements. So I'm a chartered psychologist with the British Psychological Society and HCPC. By that, it means that I'm also a practitioner as well as a researcher as well. And the reason that I joined this project is from my applied practice and also my personal experience, I really see the positive impact that physical activity has on an individual's life. And another key part of the work that I've done as an applied practitioner is working with professional athletes and mainly focused on helping them deal with injury. So going through having the injury, coming to terms with it, rehab and return to exercise as well. And that transitions over to transplant recipients as well, and looking at that link between physical and mental health. One of the things that comes up time and time again is how they impact each other. We can't really look at them individually. Your mental health and your well-being can be improved by exercise. Conversely, if you're feeling depressed, for example, it can be really hard to exercise. So that's kind of the expertise that I bring in, how we can bring the two together, because we know that moving more is better for us, but knowing's not enough. So what can we do to help change that behavior? So you know a bit about Bart and I, just give an overview of what we're going to be talking to you about. We'll give you a kind of overview of our research and some of the key partners and what our kind of big picture vision is as well. Bart's going to talk you through the research we did with transplant recipients and what we can actually take forward from that. And then I'll tell you about the current study that we're doing and give you an update of where we are at the moment, what our next steps are, and how you could potentially get involved in some of our research as well. And then looking at why we're doing this, what impact we want to have. Just to highlight as well, we don't want to talk at you the whole time. We want you to kind of reflect on your experience and share a little bit, so there'll be opportunities to do that. So we'll use the chat function, and feel free to pop questions in as we go as well. Over to you, Bart.
Sorry, on my multiple screens, I had to find my unmute button. So a little bit of background is that this research has been supported by a range of organizations, including the Open University as part of the Open Challenges, the Prince Charles Hospital in Brisbane, Oxford University, and also the UK organization, the Transplant Research Network, and lots of researchers are interested in helping out. So maybe Leigh can also later on share some of the details in the chat. And we know that there are around 130,000 transplant surgeries annually. And we also know that many transplant recipients often do not meet recommended physical activity levels that may limit their well-being and long-term health. We also know that there's limited guidance in terms of how to become more active. So hopefully today will provide you some insights, and that may help you to become perhaps more active. So just to dig a little bit deeper into this, so for example, in the UK, there are around 30,000 people who are currently receiving dialysis, and annually around 3,000 kidney transplants are taken place. And for example, in the latest report by Kidney Research UK, it's estimated that in the UK, around 10% of the population are living with kidney disease. And that costs a tremendous amount of money to support these amazing people, around 7 billion, and is expected to double in the next 10 years. And we know that some of the effects of kidney disease could be mitigated. So there is some evidence out there that most transplantees do not meet physical activity guidelines. So the estimate, and it's always difficult to get that right, ranges between 11 to around 52% of people are physically active. And I can see that my internet is becoming unstable. Can you still hear me? Yeah, good. And there is some evidence that increasing physical activity might be an attractive option for addressing some of the underlying risks that transplantees have. So there is, for example, some evidence that after transplant, people become, will gain more weight, have more difficulties to, for example, become physically active, have lower muscle development, etc., etc. So there is some evidence out there that shows that by becoming more physically active, you actually improve your cardiovascular mortality. So what does it then mean to be physically active? So Leigh, what does it mean?
Yeah, so Bart mentioned that there's some guidelines there. I'm just going to give you a bit of an overview of what they are. The key message is to try and be active every day. And when they're talking about trying to be active every day, there's two main points that that it's referring to. The first one is thinking about developing and maintaining strength in those kind of major muscle groups. And that would be in about 2 days a week, ideally. And what that looks like can vary. So it can be more things like gardening or doing the shopping, for example, lifting heavy shopping, or it could actually be doing resistance training or going to the gym as well. And the other side is around your aerobic fitness. And with that, there's, I guess, two elements it gets you to consider, two options, and that is doing moderate intensity aerobic activities. That could be something like going for a brisk walk or cycling. And the guidance says you should be doing that about 2.5 hours a week, or alternatively, you could do 75 minutes if it's vigorous intensity. So that would be something like running. It doesn't have to be all done at once. It can be kind of shorter blocks as well. And it can be a mixture of both the kind of moderate or vigorous intensity. And another thing is, we quite often live sedentary lives. We're all sitting here on a webinar. I'm sitting at my desk a lot of the time working, and one of the guidelines is about trying to limit the amount of time that we're sitting and moving a little bit more, so finding those opportunities. The key thing here is, and I think this is throughout our presentation as well, is thinking about that fact that actually any physical activity is better than none, and more still is better. So always looking for those little opportunities. That's the guidance, and I think you'll probably all agree it's actually quite general as well, and it doesn't really account for all those kind of individual differences, what someone's level of physical activity is at baseline, medical conditions, the social and kind of economic factors that all have an impact on how active we're able to be. And moderate activity isn't the same for everyone, or how you experience the activity is, and it can really depend on loads of factors. And I think the picture below sums it up quite well. So we've got lots of different events from the Transplant Games there, and it wouldn't all feel the same. For someone who's maybe playing squash on a regular basis, that could feel like moderate activity for them, but someone else who isn't very active at all, that would feel like really intense, vigorous activity. So we need to be mindful of those kind of individual differences as well, and the guidelines don't really account for that at the moment. We're gonna invite everyone on the call to just share a little bit about their current physical activity. Just to highlight, there are no right answers here at all. We just kind of want to get a snapshot and understand what people have been doing. So in the last 7 days, how many minutes do you think you've been moderately active, given what we've just discussed there? And how many minutes have you been vigorously active? So if you have a little bit of think, do some quick maths and put it in the chat. And you'll see on the screen there as well, there's 3 kind of different pictures that come up, and that's 3 different transplant recipients, and it just shows the kind of variation that one of them is down the bottom, that although they're active, they wouldn't be necessarily meeting the guidelines. And then there's another person down the bottom. You can see it's got in the last 4 weeks, it's got 30, I think it's at 34 activities that they've done, and you can see that they're actually really active. And then the one up above at the graph, it just shows kind of week in, week out a level of kind of activity, and it varies as well. So we're not always going to be the same every single week.
So for example, Declan indicates 180 minutes, and then Jessica says, according to her comment, 158 minutes. That's great. And Julia says 240. There's no competition of who does more or less. But John writes 300 minutes, and Richie says 4.5 hours-ish. So many of you seem to be very active at this point in time. which is great. There's no right and wrong on this, so it's good to see. And I'm also happy to see that Gary and I are friends on Strava for those who are into running or cycling. Cool. All right, so that's good to know a little bit about where what your current basis is. There's no right and wrong on this. So let's then dig a little bit deeper in terms of what have we learned from one particular group of transplantees who are extremely active. So we selected on purpose a group of transplant athletes, as we call them, who participated at the World Transplant Games in so-called high-intensity sports. So that's either cycling or in sprint triathlon. So these are transplant recipients who are able to do extensive physical activity for a long duration, because you have to train quite extensively in order to be able to compete at these levels. I have to say that, of course, you have to be very careful when you're looking at your own activities, whether or not you can immediately, do the same level of activities. So my next slide basically gives you a huge warning. So if you're starting with physical activity, perhaps immediately starting to participate in a sprint triathlon might not be a good idea. We're focusing on really highly active transplant recipients. So, for example, the person who won the World Transplant Games cycling event, Perry Judd, he cycled around the track in a record amount of time, and he still currently holds the so-called King of Mountain record. So he's faster, not only relative to all the transplantees, but he's faster even to normal cyclists who visit that racing track. So it shows some of the amazing things that some transplant recipients can do. But at the same time, of course, there are some transplant recipients who are experiencing barriers in order to become physically active. So what I want to do next is to show you a table of experiences of transplant recipients that have been validated in a range of research contexts, and perhaps some of these experiences might resonate with you. So, for example, in terms of barriers, lots of transplant recipients have indicated that they have physical limitations to become physically active, or that they lack the energy to become physically active, or to have, for example, comorbidity issues like, for example, high blood pressure. There's also a lot of evidence that after your transplant, you might need medication that reduce your muscle build and thus lead to lower lack of strength. And we know from research that oftentimes after transplant, people gain weight after transplant. Some might also say, I'm too old to exercise, so why should I do this? Then there are people who have more psychological barriers. So, for example, they lack the motivation or the time to become physically active, or might have fears of injury themselves, or perhaps falling off their bike. Or in my case, I was afraid to swim in the open water because I was afraid to drown. Then coping mechanisms, and perhaps some people don't have goals in terms of what to do next. And like with real normal human beings, I guess there are always post-transplant life events that influence people with or without transplants. Other factors might be that perhaps it's not your routine to go on a daily walk, for example. Then there are also so-called environmental factors that might hamper you to become physically active. So that, for example, perhaps your medical doctor is not able to give you appropriate advice, or perhaps the people around you are not very active. So perhaps there's a lack of social support. Perhaps you have no one to go to yoga with, or perhaps you have no one to ride your bike with. And then I don't know where you're at in this part of the world, but in the UK, it's often bad weather. It's often raining and cold. We know the side effects of medication that we're taking. And of course, there are also financial resource limitations that might hinder you to, for example, buy a gym membership or to get some running shoes. Then on the other side of the equation are so-called facilitators that transplant recipients have mentioned before. So, for example, if you exercise, get an increased energy level, it allows you to maintain your muscle strength, it allows you to control your weight. And for some people, and that's in particular, for example, for me, it's a real motivation. It's fun. I enjoy competing with others. And my main aim for next year at the World Transplant Games is to beat Perry Judd. I'm not sure if I will make that, but I will try. And it gives a so-called self-efficacy that you know that you can do yoga or that you know you can run, and it becomes a kind of routine for you. Some transplant recipients have mentioned that they know the consequences of inactivity, and some transplant recipients have mentioned that they want to become active because they want to honor their transplanted organ, their donor. And then there are some who basically mention more environmental reasons, like, for example, the medical staff or their sports psychologist is able to provide the right support, or perhaps if people, friends, family are able to provide social support to encourage activity. And last but not least, having a dog could be a motivation. So I have to walk my Labrador two times a day. So whether I want to, rain or shine, I have to basically go outside every day. So in the chat, again, this is a yellow screen. Are you more on the left-hand side? Are you more experiencing kind of the blue elements, and there's no right and wrong on this? There's no right and wrong. Or are you experiencing more kind of these facilitating elements when you're physically active? And sorry, this is you, Leigh, so I shouldn't have said that. So you can take the chat answers.
Few facilitators so far. It's interesting, is it Gerardo, I think, said that 12 years post-transplant on the right, and I think it could depend on where you are at your journey, whether you would have initially maybe been more on the left, and that's transitioned as well. Just when you're looking through that and putting whether you feel you're on the left or the right hand side as well, it'd be interesting to know if any other barriers or facilitators have came up for you that you don't see on the screen there, because this is only a small population of transplant recipients as well. So if something else comes up, feel free to add that to the chat as well.
Though I don't see anything in the chat, so it seems that the list seems quite comprehensive. Of studying a science degree. But I guess it would fall under lack of time, yes. Yes, and one here indicates that their health professional does not promote movement enough. Okay, yeah. Oh, that's lovely to hear, Gary, the Japan White Labrador. That helps you. Yeah. And access to physiotherapy is a barrier. Yeah, that's a good point. Okay, so lots of really interesting stories will come. And of course, we will also tell a little bit later how you could get involved in this research, because I'm mindful that this is not perhaps the medium to share your entire life story. But we would be keen to hear about your life story, perhaps at a later point in time. So let's then go to a little bit of the results. What have we learned from interviewing these 27 very highly active transplantees? And I think maybe Leigh can later post the link to the article in the chat, because it's just been published. So in contrast to this so-called comparison group, which I didn't explain very well, but the original study was conducted with 16 Dutch transplantees, so 4 kidney, 4 heart, 4 lung, and 4 bone marrow. And 94%, or 15 out of the 16 Dutch transplantees, reported physical limitations when starting and continuing to exercise. But only 7 out of the 27 highly intensive transplantees that participated in the World Transplant Games reported physical limitations. Also, quite interestingly, most of the transplant athletes that participated in the World Transplant Games reported a very high number of training per week, which is substantially higher than the average adult. So mostly participants experienced primarily facilitators, but at the same time, of course, some also experienced barriers. So, for example, participant 17, who actually is a really very highly active transplant recipient, he talked about an invisible handicap. So, for example, he wrote or he talked to us about, sometimes I feel I'm not running or cycling at the best of what I could do. Given the volume of training I have, he actually trains around 15 to 20 hours a week. And he, for example, highlighted that because we are immunosuppressed, we have to be more careful. And then he goes on to say, people don't realize how sensitive a population we are and that we have a sort of invisible handicap, which I think is very insightful. Then other participants, for example, expressed that they had no comorbidity issues, which was very different from the Dutch comparison group. So, for example, one person mentioned, I think exercise plays a major role in managing comorbidities. I mean, before my transplant, I was insulin-dependent diabetic. I managed to get off insulin, and he's now only on oral medication. And similarly, for example, participant 26 indicated that he could get off his beta blockers. I'm not saying, or we're not promoting to drop your meds just by becoming physically active, but some of the medication could be reduced with careful support by their medical professionals, which I think is a great insight. Also, participants that were transplant participants were less worried about inactivity. So, for example, participant 19 said it was a kind of a lifestyle. And another participant who was very sedentary before his transplant and who now completed actually an Ironman said, I know I don't want to be inactive. I know what it does to you. So it's quite amazing to see how some people have really turned their life around after a transplant. So what you see here, which looks like a very complex graph, is basically all the transplant recipients that we've interviewed and their medical transplant. And what you see visually is that most of the transplantees are kind of in the right bottom part. So they mostly indicated that they had so-called facilitators of physical activity. And some participants, like participant 11 or participant 27, also experienced some barriers. So it is quite interesting to see this. And if we compare this with the wider group of Dutch participants, it seemed that this group that participated at the World Transplant Games had fewer physical limitations, fewer lack of energy, were able to go on more group rides, and were able to manage and maintain more growth. And also, hardly anyone talked about weight issues, which of course is really interesting. So I'm extremely mindful that I'm whizzing through a big study in a couple of minutes. So I would be keen to hear from you before we go to the next part of the webinar, if you have any questions or comments, because I'm extremely mindful that these are very active transplantees. So I can already see that Siska in the chat wrote how many of them still work. That depends on how many times you have to train. Yes, so for example, there was a mix. So I know one participant who's extremely active, who does a lot of Ironmans. He is no longer able to work, but others work full time. So for example, the guy who won the World Transplant the cycling race, he's a full-time director in a hospital, and he still cycles 10 to 15 hours and has 2 kids. I don't know how he does it. But yeah, and were there no lung transplants? Sorry, in our study, yes, there were lung. There were indeed no lung transplantees because there were no lung transplantees. I mean, there were lung transplantees in the event of cycling and a sprint triathlon, but no one came forward. So maybe we should do that study again, perhaps in Dresden, and see if that is also relevant for others. Leigh, do you want to pick up another question?
I think the question by Jessica, I don't know the answer to that, so I don't know if you want
I also don't know the answer to that.
Okay.
Jessica, do you want to turn on your microphone and indicate why I think this is an important question? tell me a little bit, because I don't know exactly what you're looking for. Oh, I don't have access to it. Oh, that's fine. That's not a problem. I mean, feel free to. Practice on. Okay. So in the study, we didn't necessarily talk about the medication. So we have asked this, but this was not the primary focus. But if you want, I can look into this at a later point in time. Okay. So any further questions? Yeah. Oh, yeah. Those in impact and muscle strength. Yeah. Yeah. Okay, so what are we doing next? So of course, I'm extremely mindful that this is a group of participants who are extremely active, relative perhaps to the wider transplant community. So what are we doing next, Leigh?
So next we're building on the current research and want to understand across the physical activity spectrum. So we understand a bit about what's going on with those who are highly active, but what about those who are just moderately active, a little active, or even sedentary as well? We want to understand their experience and how we can help them become active. So the aim of our current project is to develop patient guidelines to support transplant recipients to engage in physical activity in a manner that is safe and sustainable as well. To do that, what we're doing is we're conducting interviews again with transplant recipients, just to understand their experience, what their transplant journey was like, if they are active, and any kind of barriers, advice from medical professionals, etc. And a key element here is a social network analysis. By that, we mean who are the key people in that person's life, family, friends, and medical professionals, physios, and what role do they play in encouraging someone to be active or not as well. And the key element here in this research and throughout the other research as well is that patient and public involvement. And by that, we mean that the research is carried out with and by transplant recipients. As Bart mentioned, he's a transplant recipient, or so are other members of the team as well. And we'll also have elements where the other transplant recipients who aren't researchers as such do take an active role within shaping the kind of framework that we're going to come up with as well. I'm going to give you a bit of an insight, hopefully, into what the social network analysis is. It's a little bit complex, so this is just kind of a snapshot of it. The transplant recipient would be in the middle there in that bit that says you, and then those key people in their life, the medical professionals, family, friends, even some of the transplant networks, would be placed on this map here. And the closer into the center is the closer the relationship, the more they speak to the individual as well. And the research shows that having just even one person within your network that is physically active increases the likelihood that you will be active as well. This is an example here. This network's one of the smaller ones, and the individual has their family as closest, so they were there kind of throughout excuse me, their transplant journey, and they've got like emotional support, etc. from them. And you'll notice their dad's in a slightly light green color. That's because he was getting them to go out for a walk like fairly early on, and has always really encouraged them to become active and to kind of build on their level of activity as well. And if you just put it to the next example, Bart, you'll see that's quite different. There's more people in this network, and then also a lot of them are green. This individual is fairly active, and their consultant is not only active themselves, but really encourages this person to be active and get some advice on how to increase their activity. And their family as a whole tend to be quite active as well. So that just gave you a bit of an insight, and they've got friends on the outside who they go cycling with and circuit training and things as well. Hopefully that gives an indication of the role that people can play within your network, perhaps, and helping you become active as a transplant recipient. And from interviews we've done so far, it does seem to follow that theme that having people within your network who are active, you tend to be active yourself. Again, we're getting you to think a little bit about your experience, and is there anyone that you can think of within your network that either encourages you to be active or inspires you to be active, or perhaps you even do activity with them as well. You don't need to put their names as such. You don't want to. You can just put whether it's kind of friends, family, medical professionals, example. Yeah, all of those. Yeah, I can see Julie's put our daughter down. Yeah, like Jessica's comment, there's another transplant recipient I spoke to, and they said they're the active person in their network trying to get everyone else to do the same. And I notice a point there from Rich. I suspect most transplant athletes and motivation is intrinsic, and that's something that did come up in the previous study that Bart had mentioned as well. So yeah, good point there.
I hadn't clocked that Perry is also on the line. So Perry, yeah, definitely the motivation is going to be there in Perth and Drayson. Don't worry, mate.
Can motivate each other.
Yeah. Cool.
Okay.
All right.
Yeah, so just to give you a bit of insight into where we are now at the project, the current research study's got 4 key elements to it. So the first one that we did was, we called it a kickoff event, and that was an online event where we shared a little bit about the research we've currently done, and also what we're planning to do to get input from transplant recipients to see was it of value, what kind of outcomes were they hoping to see at the end of it, and then we can shape the research question a little bit based on that. The next stage was then actually conducting the interviews. So in the UK, we've done 15 interviews so far, and the study is, like Bart mentioned at the start, we've got the UK side of it and then also the Australian side as well. So in Australia, we're just going to have the kickoff event, so it's kind of one step behind. Once we've conducted all the interviews, we're going to start pulling the information together from the social networks and the questions, and we'll create the kind of physical activity framework. And once we've got a draft of that, we're going to share that with the transplant recipients, again, who took part, and get their feedback on it. Does it resonate? Do they want to change anything, add anything as well, and make sure it's really their voice that's being heard within the research. I can see Winston's got his hand up. I don't know if you've got a question just before I go on to the next part.
Yeah, if you don't mind me asking a question. Good afternoon, everyone. Good afternoon, Bart and Perry. I just wanted to find out the slide you showed now indicated that the next step is or the focus is in the UK and Australia. So I'm just wanting to find out whether the framework that you are going to create from there will be culturally appropriate in other settings as well. If the basis of the framework is going to be interviews conducted in the UK and in Australia.
Yeah, so you can jump in after me if you want. Bart's going to say that it's going to be, obviously there'll be unique contextual factors within the UK and Australia, especially given the healthcare systems are different and different in each country as well. But I think there'll be some elements that could translate, but there'll be definitely unique factors that it is more relevant to the population it's done with. Don't know if you want to add on to that, Bart.
Yeah, so the initial grant we got was a relatively small grant, which was focused on the UK and Australia, as Leigh says. We're currently, and that's like also linked to the next step, is we're applying for further funding, and hopefully we could then also perhaps do some of the research in non-UK or Anglo-Saxon settings, because I do think, like with Winston, it's completely important to be mindful of the local cultural traditions and conditions.
Yeah, exactly. So the next steps, once we've got the framework in place, is we want to continue the dissemination activities. We will be publishing in some kind of academic journals, but for the think I speak for the team when I say this, that it's important that we get the message out there to transplant recipients and those supporting them as well. So we're looking at doing more dissemination activities, whether that's webinars or things we can share online as well, to make sure that our findings are accessible as well. And Winston was already raised this point as well, so thank you for that. Then we want to continue this research and expand it as well to help as many transplant recipients as possible. And that's some of the funding grants that we're looking at, and we're keen to have some that are beyond just the UK as well. And with the next lot of funding, what we're looking to do is actually expand the research as well to look at the experiences and needs of the individuals round about the transplant recipient. So that's the medical professionals, family and friends, what are their experiences, and actually what resources could help them then support the transplant recipient as well. And the final element of that is exploring opportunities with kind of key partners or charities and things that will allow that to happen, and that's kind of linking in with those over in the States, for example, about any opportunities there where we can kind of continue to build on our research. Okay, I'd said at the start we've got some kind of big picture aims and things, and we're aware that these aren't going to happen overnight, but ideally what we're looking to do from this research is actually have a standardized approach to physical activity pre and post transplant as well across kind of all hospitals. This is particularly reflecting the research we're doing now in the UK and in Australia, because speaking to people, depending on the hospital you're in, even the consultant you're working with or the type of transplant, the experiences vary, and what's on offer in terms of kind of prehab and rehab does vary quite a bit as well. So if we can get a standardized approach across all hospitals would be a good starting point. And part of that would be improving the training and guidance for the medical and healthcare professionals. It's like touched on right at the start. They know themselves probably that being active is good for your health, but do they know how to have those conversations? And actually, do they know how to support a transplant recipient to be more active, given their kind of medical history and things like that as well, and other comorbidities and other factors that have an influence on it, especially if we start thinking about kind of socio-demographic differences. And the final part is actually having those resources and guidance available for transplant recipients. So there isn't really any, I suppose, set place always to go to find that guidance. You quite often are left to look for it yourself. And from people we've spoken to, it's a sense of looking on, having a Google, or actually speaking to someone else that's a transplant recipient, or coming across Transplant Games and then looking from there as well. So to have those resources readily available to transplant recipients to help them actually make behaviour change happen and sustain it as well. So we talked a bit about becoming active or increasing your level of activity. And like we said at the start, we're not suggesting you go out and take on any big challenges or anything like that. And if you are wanting to make changes, definitely think about whether you speak to your medical professionals about it as well. But the key message is that any physical activity is better than none, and more is better still. So have a think about who's in your network, and that could be who you get advice from around becoming more active, or is there people you can exercise with as well, because as Bart touched on, that social support and having people to exercise with does make it easier, and you're more likely to keep going with it as well. And another thing that comes up as well is making those small changes. So think about things you're already doing. It could be, for example, if you go to do the food shopping, park slightly further away from the door to the supermarket, so you get a little further to walk to go in and do the shopping. And then when you're coming out with the shopping as well, or if you're already active, and it sounds like quite a lot of you are, if you want to increase your activity, maybe add on a little extra time to your run, or a little extra distance, or do more reps at the gym, for example. So it's looking for those kind of small changes that you can do. Or in Bart's case, try and beat another competitor, and that'll encourage you to do a little bit more. Okay, so aware we went through quite a lot quite quickly there. if you do want to hear more about our research as well, or have any questions, or if you're interested in joining in future research, there's a QR code there on the screen, and I'm just going to pop a link in the chat as well. If you want to get in touch, please do so, and you can fill out the kind of Microsoft form as well. And Bart and I's email addresses are going to reach out as well.
Cool.
Thank you very much, Bart and Leigh. Bart, did you notice a couple of questions before? I think you replied at least. So would you like to address them right now?
Yeah, I've scrolled through a lot of chat messages. Let me just try to find one. I think one was a question from Sandeep.
Yeah, and then we have one from Tanya, and then we have one at the end from Richard Smith, I think.
Yeah. Sorry, because the chat is quite long, I can't seem to directly find it. If you have it available for me, Anders, what the question was?
I think one of the questions, did the study also research? Oh, sorry. I think Tanya's question was about if the recipients had been physically active before receiving an organ or not.
Yeah,
I think that was one of the other questions. Yeah.
So there was a mix. So some people were extremely active before they did Ironmans, etc., and then once they recovered for 2-3 years post-transplant, they slowly went back to Ironmans. But there were also other participants, like participant 22, who was a couch potato, in his own words, who then decided, okay, I don't want to remain a couch potato, and from doing nothing, eventually after 5 years, did his first Ironman. So there's definitely a mix, and I guess what the message of Leigh and me is, don't immediately do an Ironman or a triathlon. Start small and do little bits at a time, and then hopefully with the right support, you will start to feel, oh, actually I can run a kilometer, and oh, I can run 2 kilometers, and then before you know it, hopefully things will pick up.
Okay, good. Yeah, and then we have one question from Sandeep Kaimal as well. Did the study also research the correlation between current physical activity and the future recurrence of organ failure?
I'm hoping that we can redo this study perhaps in 10 years' time, because of course this study was very recent. And as far as I know, I'm in contact informally with most of the 27. So this is very anecdotal, this is not very scientific, but I think all 27 are doing well. But I think what would be really interesting is in 10 years' time, revisit those 27 participants and then see if they're still doing well in 10 years' time. So fingers crossed, and we will keep in touch.
Bart, are you able to put the link to the published study in the chat? I couldn't find it when I looked, just Winston's asking if anyone else wants access.
I will do that.
Perfect. Yeah, and then we have Rich Smith's question. So that was more addressed to you, Leigh. Is there a difference between competitive sport and physical activity? So do you have any comments about it? Because physical activity is more like promoting health, and and while competition is a little bit of a different motivation.
There's definitely a big difference between the two, and that's something that we're trying to explore more in the research we're doing now. So I'm very aware for some people that we think about sport in general, especially the competitive side of things, that is either not an interest of them, or actually there can be can create even more barriers as well if you're not someone who identifies or even likes sport, because let's be honest, not everyone likes doing sport. I'm presuming that most of the ones on this chat will, but one of the things that I'm really interested in, and I can see another member of the team, hope she'll mind me saying, Elaine Duncan, on the screen as well, and she's got quite a few similar interests to myself around actually just helping people live a more active life and be kind of fit for daily living, and how we can support that and really understand the barriers they experience as well. So there is a key difference between the two, and I think that's an area that we will be kind of looking into a little bit more as well. And some of them might never be sporty, and that's okay if we're just helping them improve their quality of life and their health through moving more as well. And it's hard to talk about the two in one thing because they are quite distinct as well. Hopefully that answers your question a bit, Rich. I see Winston's got his hand up as well.
Yeah. Yep. Sorry for raising my hand again. Gary made a statement on the chat that says that many members of his transplant team are not aware of the level of activity at the World and USA Transplant Games, and there is a need to educate them. Who do you think, or is some of the work flowing out of the study for this information to be disseminated at some of these congresses in terms of presentations, posters, or papers to actually inform the transplant surgeons and physicians of the actual level of activity that does take place post-transplant? Thanks.
Yeah, I think that is a great comment, Vincent. Thank you very much for sharing this. So in a follow-up study, which we can't share yet because it has not been accepted yet, but we specifically looked at whether these 27 transplant recipients received medical support, and around half received quite positive encouragement, but the other half was quite mixed. So for example, anecdotally in my own unit in Oxford, because we're working very closely together with one consultant, his own estimation is also that most at least half of the consultants are not encouraging those conversations that you're basically saying. So I think there's still a lot of work to be done to encourage not only us as transplant recipients, but also the medical professionals and the support structure around it, that actually doing physical activity in a safe way could actually be quite beneficial. So I think we need some more work on this. Thanks, Brady.
Good. Thank you very much. Any other questions? So Manvir, Victor, please.
Hi, guys. I totally agree with what you guys are saying. We don't have enough support as patients. In Asia, I'm based in Malaysia, and after I lived in the UK for a few years, and I came back here to Malaysia, I realized the disparity, and we are trying to do that with activating ourselves. So what has happened is in 2022, we had 3 transplant recipients, and we did a project where we climbed the highest mountain here in Southeast Asia, which is Mount Kinabalu. And that really opened the eyes of all the doctors, because we went up, we did a huge publicity stunt with it. 25 people went, the support group went up. So 3 patients made it up. We came down. So that has spurred a lot of the doctors to having these conversations with us about doing other things. Now we've started a transplant walk, which happens every month once on a Sunday morning. And that has actually started in 1 city. And now we are going to 3 cities to do this. And it's a very simple thing, because Asians are not very active anyway. Just going for a 2-3 kilometer flat ground walk is already a bit of a chore for people, especially over here where it's really hot all the time. But we are planning in 2026 now another climb, and we are aiming to take 20 transplant recipients up. And now the doctors have bought into it. I've got 5 doctors who are coming, nephrologists, urologists, and cardiologists. They are walking up with us, and they say, okay, we'll come. We'll support this, So we're trying to get some more nurses. And I guess it is trying to get this information out there. I love what you guys are doing. Please share it with us once it's done, because we want to use it to share that message here, translate it, hit as many people as possible. Thank you.
Yeah, thank you so much, Manvir. That's an amazing example of empowerment of patients. So that's exactly what we're also looking for. So if there's anyone else in the chat that wants to raise that, that's fantastic.
Okay, good. Any other questions? We have a few more minutes left, so yeah, on my watch 4 more minutes. Otherwise, I can ask you a question. So I'm thinking a little bit about, you know, from the federation point of view, and also the general physical recommendations that you presented. So would you say that, at least this is my interpretation of your presentation, so would you say that it's fair that we should develop, or you know, you researchers should develop physical recommendations for different organ types, or for transplant recipients in general, or for different purposes? We talked about physical activity versus competition, for example, or what's your reflections on that?
Yeah, there's a quite big debate amongst the research team as well, who are represented by different transplants. And some say that all the transplants are very different. Others are saying, you know, we're all the same and there should be the same criteria. I guess this is what we're trying to showcase, is that we're trying to make sense of what is feasible and what is not feasible. And for example, somebody picked up that there were no lung transplantees in our data. So that indeed, you're absolutely right on that. And I always say, and I'm joking to Perry, but Perry, you know, he's not a real transplantee because his bone marrow and he doesn't have any medication. Well, I'm on very heavy medication. So we're comparing apples to oranges. I'm joking a little bit. But I think it's really important to be mindful of the individual medical circumstances of everyone. So I think we still have a lot of ground to cover to not only raise awareness amongst medics, but also the people in general. And I guess, Leigh, what do you want to add?
Yeah, I think on that point about the guidance and support in terms of being a transplant athlete and just someone who wants to get kind of active or moving more, I think that is probably quite two distinct groups as well, especially if someone's been identified as being an athlete or being really active afterwards, and then want to do so post-transplant after being like that beforehand. And I think that's where if the medical professionals don't understand how fit someone was before or don't take that into consideration, I think that is completely different. And a lot of the kind of return from injury kind of research and things would probably come in there more so potentially than if it's someone just trying to become more active as well. And yeah, I like what Liz put there, that there's so many different factors that one size doesn't fit all. And I think that's something that we want to understand, is how we can support the medical professionals to help have a more individualized conversation. And that comes probably back round to the behaviour change side of things, and supporting people to do that.
Yeah, that's good. Thank you very much. So I think you replied to Greg's question, Bart. Is that right?
Yeah, and I'm happy to send.
Or would you like to say something about Greg's question? Is there a study showing better outcomes for?
Yeah, so there are.
Yeah. So would you like to comment? Make a brief comment on it?
Yeah, so there are lots of systematic literature studies that show the kind of effects, but it's always really one of my bugbears, and I guess that's also why we did this initial study. Most of the studies conducted on physical activity are what we would call relatively moderate and low intensity physical activity. So there is some good evidence there, but there's not a lot of evidence on kind of more intensive activity, or moving from no activity to a little bit of activity. So I guess that's why I'm keen to explore this a little bit more in greater detail.
Mm-hmm. Yeah, and I also think that Dieter Montbalieu, right, from Belgium, I also think that he has done some studies about this, the degree of physical activity and so on. So yeah. Okay, good. Thank you very much. The time for the webinar is up, so I will just share you a link from our website where you can find the recorded webinars. So that's the link. So on the wtgf.org and then the education drop-down menu, and then research webinars. Okay, so thank you very much, all of you, and thank you in particular to Bart and Leigh for this great study. And I would like to give you a great round of applause, and also wish you good luck for your future studies. So thank you very much, guys, and see you around. Bye bye.
Yes, thank you, everyone. Bye bye.